here to talk to you about data stewardship and what we're doing. And I'm probably kind of preaching to the choir here in terms of the importance of health data stewardship, given the role that HDRN plays in our health data ecosystem. But want to just go through kind of how we've approached this as part of this initiative. I'll actually talk through the initiative and what we're doing. Hot off the press, you'll be able to kind of go and actually look at our framework and a governance model that have officially got the official notifications are going out tomorrow, but they're now up on our website. So we're very excited about that. And then also talk a little bit about what we're trying to do to put health data stewardship into action. And as we said, it'd be really great to have a conversation about where we can take all of this work. So I think we're all familiar with why health data is so important to our country's health system, to provide information for patient care and to really drive improvements to the health system and to patient outcomes. But we know that there are challenges with the data, and really what we're trying to do with the data stewardship is unlock its power and get the data to where it's needed. And why do we need it? Well, as I mentioned, we need to have patient data flow and travel with the patients when they travel through the healthcare system. We may have all experienced this where our care providers, you go from one to another, they don't have the information that they need to make good decisions about your healthcare. We need to have a sustainable health system, and to do the analysis and work out what's good and where data needs improvement. We need that data to really help make those decisions about how to manage the health system as we continue to move forward. And I think two new aspects of why health data really needs to be considered critical national infrastructure is the economic benefits of the health system. So oftentimes the health system is considered a cost to us, but really it's almost 13% of our GDP. So it's an important economic sector in our economy. So, and we can make it more effective and more efficient and get more economic value out of our health system. It can fuel health innovations and biotech. We know it's probably the only time I'm going to mention AI, but drivers of AI, really important as all of these innovations, we can take advantage of those to help support improvements in our health system. And last, but definitely not least, over the last year, I think Canadian data sovereignty has become a topic of conversation. So I know around HDRN tables and others, the concepts of Indigenous data sovereignty have been top of mind. But I think now we're also, with the political situation that we're in, we need to look at actually our country's sovereignty of our own data to make sure we have control over our health data at all different levels. So again, I think you're all very familiar about the challenges that we currently face. With our federated system, the provinces and territories are responsible for delivering the health systems in each of their jurisdictions. And that has meant that they have built up their own data, their own rules, and their own priorities. And so we have all of these data silos, complex and inconsistencies in processes and the rules around how you can access and use that information, which really limits the data sharing. And so we know that all of that data fragmentation, the lack of productivity in terms of how long it can sometimes get access to data, means that we're slower at kind of doing innovation, and that leads to poorer outcomes and quality of care for Canadians, which we're all kind of trying to focus on. And we also know that while there are technology challenges and there's lots of technology projects, a lot of the underlying challenges are not technical. They're related to organization, governance, and human factors. And that's where the data stewardship comes in. So we need to make data more easily available to those who need it. We know we need to ensure that that use is safe, responsible, and transparent. We need to reduce the administrative burden and improve the efficiency with which data flows through the system and researchers and others can get access to it. And we need to have better coordination across jurisdictions. And so while we're trying to take a national approach, we do need to support individual jurisdictions in terms of their needs and priorities and where they're at with their maturity of their digital and data systems. And We also need to reflect what patients value, and we need to find a way to center patient voices at the core of the decision makings around what happens to their health information when it's in the system. So when we talk about data stewardship, what do we mean? And so as part of the work that we have done over the last year and a half, we've come up with a definition. We looked at lots of existing definitions of data stewardship, and ours does have a slightly different flavor than some others that you often see in the kind of literature. And what we've really honed in on is the responsibility to take care of data, both for individual kind of patient benefit and public benefit. So I'm not going to read through all of the sub-bullets, but I think one of the key pieces around our approach to data stewardship is that we're looking at the strategic levels of what we actually need to do to change the environment and conditions for data use within Canada, as well as the operational aspects of stewarding data and making sure everyone who's handling data on a day-to-day basis does so in a safe, efficient, ethical, and transparent way. We grounded all of our work in the Pan-Canadian Health Data Charter principles that the federal, provincial, territorial governments adopted a couple of years ago. And that was some of the charter came out of the Pan-Canadian Health Data Strategy Expert Advisory Group reports. So what we're trying to do is kind of take those principles and actually put them into practice and figure out how we actually make all of this work. And really, we're trying to benefit everybody who needs access to health data. So first and foremost, patients, their families, and the public. We know if we give patients access to the data, that will enable them to take more power over their care and their care decisions. Those health providers need to have the data at their fingertips to be able to make care decisions about their patients and also look at how they can improve their own practices. As we found out in the pandemic, we know public health needs to have data to protect Canadians against threats to public health and to promote and protect the well-being of communities. Our health system leaders need those data to manage the health system and to improve it. One of the key parts that HDRM plays is providing information to researchers so that they can access data for new discoveries and new approaches to really help drive that health system change that we need to make. In terms of our Pan-Canadian Health Data Stewardship Initiative, we're really focused on three key aspects. One is how we can tackle all of these challenges at a national level while kind of respecting the sovereignty of each individual provinces and territories, and how we can get that agreed upon governance and collaboration to make the decisions and drive forward progress so that we can all take advantage of all of the amazing brain power that we have across the country. Based on the work that we've done, we have created, and it's now publicly available, our stewardship framework that really has kind of distilled down the key components of all of those issues and challenges I talked about, those components that really need to be improved to drive forward improvements in data stewardship and improve data access and use. And then we really need to look at putting those things into practice. So providing tools, working on projects with stakeholders, and how do we equip the people involved in data to have all of the knowledge and skills that they need to put the framework into action. Over the last 18 months or so, we have done a lot of stakeholder engagement. This is a very busy slide, so I'm not going to go through all of it. And I think the numbers have actually changed. I think we're up to over 200 now individual stakeholder engagements. We've talked to lots of different groups of people. We've had 2 advisory committees, an expert advisory committee that HDRM CEO Kim McGrail has sat on and provided lots of great advice to us. And we've also had a jurisdictional group that have provided input from a jurisdictional perspective to help us get to where we are today. And then we've met with lots of different organizations to raise awareness and get their input into the deliverables that we've produced to date. We hosted a forum at the end of May, and I know there were a few people from HDRN sites. I know there was a couple of folks from ICES who were there, as well as Kim and a couple of others that participated in a forum that we brought people together to have a good conversation and really bring a coalition of the willing together to help us drive this forward. And we've presented at lots of conferences and workshops. And we've also started our engagements with patients and populations. We had patient partners at that forum I mentioned, and we also had some patient focus groups to provide input on our hallmarks of data stewardship, but to provide insight and input. And I think the feedback we got, which is probably not a surprise to you, as I know you have your own public advisory forum, is that patients were passionate and highly engaged in health data stewardship and understanding what's happening with their data. And while they want their data to be used, they do want to understand and be involved in the decision making about that. So we got some great feedback and we made some changes to some of our key deliverables as a result of that feedback, and we'll be continuing to work with patients and communities to evolve the stewardship. So not just engagement, but also key parts of the governance and decision making as we move forward. Quickly, I'll just touch on the framework development process. There's always been a lot of work already done before we started the project that we took over. As I mentioned, we had our inputs from our advisory groups. We did a lot of environmental scanning about what already existed. We tried to do some practical assessments and use cases to see how we could apply the framework to help address key issues. We incorporated some of the insights and feedback from our forum and patient engagement and the open consultation process that we had. In September, our CEO, Andy Chuck, took the framework and the governance model to the Conference of Deputy Ministers face-to-face meeting and got endorsement for our approach and support to continue the drive forward. So I'll go through a couple of the key things that we presented. I'll just pause here because the framework is live now on our website. So this QR code will go to our health data stewardship web pages. So you can go and take a look at the framework in detail and the governance model, but I'll show you I'll go through a high level overview for you. So here's our stewardship framework. So it kind of, as I mentioned, touches on those key concepts that affect our ability to use data. So it kind of, at a very high level, goes from that, as I mentioned, those strategic things where we're trying to change the conditions with which organizations and the whole system need to look at how we think about sharing data, all the way through to kind of operational stewardship and what do you need as you're managing data and using data. So I think at the very left-hand side, we have what's probably the most important, some of the most important, but also the hardest things that we need to change, which is around the culture with which we approach data sharing and thinking about not just protecting the privacy of patients, which is still utmost important, but how we can kind of think about that duty to share data and be able to make the most use of it, because there's risks to not, healthcare tends to be a very risk-averse culture generally, and so how can we address the risks of data sharing in a much more kind of balanced way and think about the benefits and the risks of not sharing when we're doing these types of things. Legislation, regulations, agreements, all of those things, we know that there's work that we can do to align legislation across the different provinces and territories, but also that there's more that we could do within our existing legislative framework. And how can we, a lot of the feedback we got was around the interpretation of legislation and which is done inconsistently. So how can we address those types of issues? Data strategy, data governance, all really important things. And I think the stewardship skills and literacy came across very strongly from our stakeholder engagements, really trying to make sure that the people who are doing the work really understand how they need to do it, not just for those who are kind of managing the data day to day, but also the decision makers and sometimes even the lawyers who are making the decisions about the legislation. They may not be very aware about the risks and challenges about data. Two very important things that go across the whole framework are our commitment to First Nations, Inuit, Métis data sovereignty and data governance approaches, and ensuring the work that we're doing aligns with all of the work that is happening, and that we're a support to all of the First Nations, Inuit, Métis, so they can get access to the data that they need to address their own priorities and how we can support that and make sure that the data that sits in non-Indigenous health systems is treated in line with those data principles. And as I've already touched on, the public trust and engagement is really foundational to ensure that our data stewardship approaches reflect the public values, needs, and expectations. So as part of this work, we have created what we talk about hallmarks of health data stewardship. So one of the key things our stakeholders told us was, well, what are we aiming for? What's that vision? What does good data stewardship look like? So this is our high-level view of that. This is what we're aiming towards in terms of making sure that we're making data accessible and usable for those who need it, that we're safeguarding data against misuse. We're doing all of our work and adhering to our laws, our policies, and our ethical standards, and that we're being transparent about how data is used and shared. So we're trying to, we'll be embedding all of these in our approaches to kind of changing that culture and also how we're applying and thinking about the decision making going forward. And again, look, this is my last slide on the framework. We know that stewardship needs to follow the data lifecycle. It needs to be used at every different stage. There's lots of different lifecycle diagrams, but one of the key things we did with this one was really try to use language that would be more accessible to the public, and also to reflect that we know one of the key things is not just what individual organizations do, but how we need to reflect the data that kind of comes in and out of organizations and reflect the stewardship that needs to be around the actual sharing of the information. So I'll just spend a couple more minutes on the governance model and our approach to governance, which is a kind of unique and key thing that we're going to be using to drive forward our approach to data stewardship. And really the key thing is trying to get a Team Canada approach. So when you're designing governance, you need to understand what you're trying to govern and what the functions of that governance model are. And for us, we're really trying to change those conditions. So the top priority is that kind of strategic stewardship. So we're trying to get a strategy for the whole country that all of the provinces and territories can get behind, create a action plan that will drive the key priorities forward, and then we'll manage the action plan and make sure that we deliver on it. We need that coordination across the health system is complex. So we need that coordination across all of the different aspects and all of the different networks that exist, including HDRN, so that we can not duplicate work and take advantage and scope and scale that work. We need to support jurisdictions as they implement approaches and learn from one another. We need to build public trust, and then we need some kind of oversight mechanism to kind of deliver on and make sure that the promise, the action plan is actually implemented and that we're measuring the outcomes. So here is what our governance model ended up with. It's a bit of an evolution of the advisory groups that we had set up for our development phase. We have our Data Stewardship Collaborative, which is our key body that's going to be advancing the solutions that span jurisdictions. So those people who are province and territorial reps, federal departments who are involved in healthcare, and hopefully First Nations, Inuit, Métis representatives. A multi-interest advisory panel is designed to bring together diverse cross-sector voices into the governance model. So we know that we need to have public and patients involved, but we also need to make sure that we hear from clinicians, data users such as researchers, and others who can provide key aspects so that we are making sure that we have an inclusive governance and we understand what those priorities are and that they're not just driven from the system itself. And we'll have working groups who are actually going to do the hard work of actually coming up with the recommendations and solutions to these projects that all feed into the priorities. And kind of overseeing all of this work is CIHI as the strategic coordinating center. We're going to connect all of these pieces together, but also connect in, there's a more complex version of this diagram. There's a lot of existing other bodies that we need to connect into across the board. And one of the key things is that we'll actually be reporting to both two key FPT government committees, the Public Health Data Steering Committee and the Health Data the digital health and health data priorities table. These were set up post-pandemic to really help drive the FPT joint working plan together. But one key thing is that we need to be able to make sure that the work is connected, particularly around the data side, across these two key parts of the initiative. So my last couple of slides are really about where we're going. Now that we've got that framework and governance model kind of figured out, what are we actually going to do to put data stewardship in action? So first of all, we're right now standing up those new governance bodies and creating that action plan. So we think by the end of the fiscal year, both those two key bodies, the collaborative and the multi-advisory panel, will be up and running, and we should have a first draft of the action plan ready for their approval before the end of the fiscal year. We're working on some driver projects. Most of these are kind of just getting started in terms of working with jurisdictions and other stakeholders to really look at how we put data stewardship into action and focus on that real world implementation and learning as we go forward. We're working on resources above and beyond our initial framework and putting a toolkit together of resources that already exist and also some additional ones that have been highlighted through our consultations to really help enable effective and efficient decision making and data operations. And last but not least, we're going to ensure that we continue all of our engagement, particularly with the public and patients. So here's a snapshot of a few key priority projects. We're working with the Public Health Agency around trying to get better immunization data. As we know, we just lost our measles elimination stage, and one of the challenges that's been raised that has been well known and long-standing has been our ability to actually extract immunization data for those immunization registries. So we've got a good understanding of how well our populations are immunized. We're also working with InfoWay on, as part of that interoperability roadmap, and implementing a patient summary standard around how to get key information standardized across the health system, and how that data can help support the flow of data across data for patient care. One of the things that we've been talking with Kim about is how we can support and work with HDRN on some of the stewardship issues that are more related to research and innovation. And one of the key things that came up was kind of having a better way of assessing risk and benefits for data custodians, so that they're not just thinking about the privacy aspects of data, but also the benefits and the risks of not sharing. So we're pretty excited about that. And just before this call, David was mentioning privacy legislation. So looking at tools that can really support the consistent interpretation of current legislation, as well as advocating for changes for better connected care and data sharing. Hopefully you're aware, but the federal government is looking at reintroducing Bill C-72 around interoperability, and also Bill C-27, which was the replacement of their current PIPEDA legislation as well, which really impacts primary care providers. This is a very busy slide, and this is my last slide, but this is just to give you a bit of a flavor of, through the consultations, some of the key issues and challenges we've identified. Some of them are very cross-sectional. Some are related specifically to using data for research, innovation, and AI. And then some are very focused on particular topics or sectors within the health system, and CIHI is working on some of these solutions already through some of our other strategic initiatives, such as our hospital data transformation project for hospital data. So this will be kind of some of the start of our action plan that we'll be working on.